Hello everyone, my name is Sami Sayed and I'll be talking about leptospirosis. Some background information on leptospirosis. Leptospirosis is a zoonotic bacterial infection. It's caused by the genus Leptospira. It is a highly motile, spirochete-shaped bacteria. It is aerobic. It is approximately 0.1 micrometer in diameter and from 6 to 20 micrometers in length. There are many pathogenic species of Leptospira. Some of the examples are included here. Leptospirosis is one of the most widespread infections around the world. It's found in all the continents, with the possible exception of Antarctica. The incidence of leptospirosis infection in humans is higher in tropical regions when compared to temperate regions. However, the infection is seen in both developing and developed nations. And globally, approximately 1 million cases are seen every year. And of these 1 million cases, there are approximately 58,900 deaths. And these numbers may actually be underestimated because the morbidity and mortality is higher in the poorer regions of the world, and routine surveillance in these regions are not usually done. So a lot of the cases may be missed. So how is leptospirosis transmitted? In almost all cases of leptospirosis transmission, it is animal to human transmission. Human to human transmission is almost non-existent. And the leptospirosis bacteria is spread through the urine of infected animals. So the bacteria most commonly live in the proximal renal tubules of the carrier animals. Some of the common carrier animals include cattle, horses, pigs, dogs, rodents, and other wild animals. It's been found that almost every mammal and marsupial can be a leptospira carrier. Even humans, but usually humans are not chronic carriers. And when these animal carriers urinate, they contaminate the soil, the surface water, streams, and rivers. And when humans come into contact with the contaminated water or the urine, they can become infected. The bacteria can enter humans through small cuts, abrasions, through the mucous membranes like the conjunctiva and wet skin. What is the pathogenesis of leptospirosis? So once the leptospira bacteria enters the body, the bacteria can stay in the bloodstream for up to 7 days. And this accounts for the bacteremia phase of leptospirosis. Symptoms occur when the number of leptospira bacteria in the bloodstream reach a critical level, and damage to the endothelium of blood vessels can start occurring due to undefined leptospiral toxins that are released. And these toxins can cause localized ischemia in organs. So you can see renal tubular necrosis, hepatocellular damage, pulmonary damage, and in some cases you can also see meningitis, myositis, and placentitis. So what are the signs and symptoms of leptospirosis? Leptospirosis is a systemic disease, so you have a wide range of symptoms. The illness can last from several days to a couple of weeks. And some of the most common symptoms you see are fever, severe headaches, chills, severe myalgias, vomiting, jaundice, conjunctival suffusion, abdominal pain, diarrhea, rash, anorexia, and a lot more symptoms. The clinical presentation is not very specific. Most of these symptoms can be mistaken for many other illnesses. And leptospirosis usually happens in a biphasic manner. So you have the first phase, which is an initial sudden onset of acute febrile illness with some accompanying symptoms. And then you have the second phase. Usually after phase 1, you get better, but then 2 to 4 days later, you'll have a remission of disease with, again, the same symptoms. So the most severe form of leptospirosis is called Weil's disease. And Weil's disease can either present as a biphasic illness that progresses to Weil's disease or present as a single progressive illness. You'll usually see jaundice, and this happens due to cholestasis of sepsis and not really liver damage. You'll also see acute renal failure and hemorrhage. Weil's disease has a high case fatality rate of up to 5 to 10%. Some of the lab work can show increased serum bilirubin and transaminases. You can also see a low platelet count. And if you have renal failure, then you can also see an increased serum amylase, which is often confused with pancreatitis. You can also have pulmonary and cardiac involvement. Cardiac involvement is relatively common, but pulmonary involvement is often a sign of poor prognosis. So how to diagnose leptospirosis? Usually you see the clinical presentation, and then after that you must have a high clinical suspicion, especially in endemic areas. But it is difficult to diagnose due to the similarity of symptoms with many other infectious diseases. There are diagnostic tests available, but are not often done due to the low clinical suspicion of leptospirosis. The definite diagnostic test is a culture, but it is slow and not very sensitive. If you do use a culture though, you can isolate leptospirobacteria from the blood or CSF during the initial 7 to 10 days of illness. It can also be isolated from the urine in the second and third weeks of illness. You can also get leptospiral DNA through PCR, and you can also do immunohistochemical staining. But the most frequently used serological tests, the most frequently used diagnostic tests are serological tests that show leptospiral antibodies. So the test is called microscopic agglutination test, or MAT, and this has a high sensitivity and specificity. The high-risk groups for leptospirosis are the ones that are exposed to this bacteria due to their occupation. So this would include farmers, mine workers, sewer workers, slaughterhouse workers, veterinarians, animal caretakers, fish workers, dairy farmers, and military personnel. And also the individuals that participate in recreational activities that involve immersion in water. So for example, swimming or kayaking or rafting. And this is more common in tropical climates. So what can be done to prevent leptospirosis infection? You can have occupational hygiene, so wearing protective clothing, avoiding water and urine splash, but this can be hard to implement in your occupation. Avoiding contact with farm animals, but again, this is not practical for those that work with animals. And for recreational exposures, you can avoid swimming in areas that might be contaminated with their animal urine. Another method is vaccination. So you can vaccinate livestock, which reduces urinary shedding of the bacteria. Vaccines are available for cattle, pigs, dogs, but these vaccines are only partially effective. And you can also have educational programs for animal handlers on how to prevent becoming infected with leptospirosis. How do you manage leptospirosis? So for most patients, the mild disease is self-remitting. It will improve without intervention. So you'll have supportive treatment like hydration and antipyretics to reduce fever. In some cases, amoxicillin and penicillin may be of benefit for mild disease. About 5 to 9% of patients will require hospitalization because of more moderate clinical symptoms, and about 1 to 5% of patients will develop severe disease like Weil's disease. Due to the unclear understanding of the exact pathogenesis of leptospirosis, the optimal medical treatment is still not well understood. But for moderate and severe form of disease, antibiotics are commonly used. Doxycycline is actually found to be effective for reducing both severity and the duration of disease. And for severe disease, it is more immune mediated. So along with using penicillin, you can also use immunomodulation. These are my references. Thank you for listening.